Good morning, everyone, and welcome to Vital Wisdom. I'm Dr. Eli Camp. And as you know, what we talk about, well, you may not know, but I'll remind you, what we talk about on Vital Wisdom is the body's ability to heal itself, this capacity that was designed into us. Who knows who did it, when it happened, but we heal just like all other organisms on this planet. And there's some really important things we have to remember, which we talk about in every episode. Give the body what it needs, get out any junk that's poisoning it and preventing the healing from happening, stimulate that body's healing ability by working with it. And what happens? Well, healing happens. Today, I'm very excited and very honored to have Dr. Christie Fleetwood join us. She's been a mentor of mine, a colleague, a friend. We've worked on projects together. She's an amazing teacher. She's an amazing doctor. And thank you so much for being here. I'm so excited to share your voice and knowledge and wisdom with the folks that I talk to every week. And I'm going to let you introduce yourself and then we'll just jump right in. Thank you. Thank you.
Absolutely. Thank you. This is fun. I'm noticing that under my name, I need to change an initial. So before we get off of this call, please show me how to change my
I will do that. Absolutely.
So I will introduce myself by my credentials. To start with, I am a naturopathic doctor. I'm also a registered pharmacist. That's the RPH. And I'm not a VNMI, a vitalist credentialed through the Naturopathic Medicine Institute, which is fabulous. But I'm not a fellow. I'm a fellow.
Yay. Yay.
Very excited to have that fellow credential through the Naturopathic Medicine Institute. So people often ask, how did you go from being a pharmacist to being a naturopathic doctor? Because that seems kind of like a 180-degree shift. Yes, indeed. And for me, it was. Because I heard a lot of stories as a retail pharmacist about people failing conventional medicine. And I saw a bunch of patterns as a pharmacist, filling prescriptions that didn't correct the problem. It was just the drug got higher and higher dosing, and then a second drug was added on to it, and a third drug was added on to it. And instead of getting better from the first diagnosis, they now had 2 diagnoses or 3 diagnoses. And the diagnoses just kept stacking up, and the drugs just kept stacking up. And I started asking questions about, is it possible that maybe we aren't actually helping people? Is it possible that we're just stopping numbers, but the disease process is still going on? Because people are getting sicker. They're not getting weller. They're getting sicker. And I was told, no, stop. What are you doing? Those are stupid questions, Christy. Well, okay. And by the way, that white bread that you're eating as a type 2 diabetic, don't you think maybe that has something to do with your numbers? Bread is bread is bread. A calorie is a calorie is a calorie. A fat gram is a fat gram is a fat gram. But I was noticing that the biggest people coming to my pharmacy counter with their grocery baskets, because I worked in a big warehouse filling 350 prescriptions a day. That was a little scary in and of itself. But then I worked at a much slower pace in a brand new grocery store. So I kept seeing people's groceries as well as their prescriptions. And the biggest people had the 0 fat grams and 0 sugar gram foods in their carts. It just seemed a little bit weird. And then I was failed by conventional medicine, which made it personal. And I was like, okay, well, I could be dead in 8 months while I'm waiting for the specialist to see me. So what did we used to do before we got taken over by petrochemical pharmaceuticals? What? There had to have been something. And sure enough, there were lots of things, actually. Pharmacy, as we know it, is only a little over 100 years old. That's it. And we've been around for thousands of years. So in a series of coincidences, I learned about naturopathic medicine and then quit my career, sold everything that I owned, left everyone that I knew except for my newly married husband, saying, honey, please follow me. I'm putting power of attorney into your hands for you to sell this custom built home that we had made for us on the property where we got married. Please follow me, sell this gorgeous home and follow me to the other side of the universe so I can go back to school full time to become a naturopathic physician, which that's a story in and of itself. But anyway,
How long had you been a pharmacist at this point?
I had been a pharmacist for a decade and knew that I could not continue. I couldn't wait till retirement age to leave that white jacket and pharmacy counter behind.
Right. At
That,
least it didn't go 20 or 30 years, right? At least it happened
right.
sooner than that.
It happened sooner, which was disturbing for my husband, who had married a pharmacist, right? With good
Right.
income, disposable income. We were dual income, no children. We could just fly off to play someplace on the globe when we felt like it. And I was going to throw all of that away to become an unknown thing. A what? Nobody knows what a naturopathic doctor is on this side of the universe. So
Right.
what are you thinking? And that's what everyone in my family said. You went to the Medical College of Virginia to get your pharmacy license, pharmacy degree. Just go back to the Medical College of Virginia, stay in Virginia, and go be a medical doctor. Oh, heck no. I know enough about their stuff. I don't want their stuff. I want all the stuff that they don't do. And so I never really wanted to be known for my pharmacy skills, my pharmacy brain inside our profession.
Well, that
I
didn't
can
work
teach
out.
philosophy. I can teach other things, y'all.
Right.
But pharmacy is kind of woven into my frame now. But I teach it in a very different way. And I'm very passionate about this because we, as naturopathic physicians with such a broad scope of practice, we are uniquely positioned to provide informed consent. Informed consent needs to happen with everything, I think. Like, would you like a cup of tea? Yes, I would like a cup of tea. Tell me about the cup of tea. What kind of tea are you making? I want to make sure that I understand that I'm getting the kind of tea that I'm imagining in my mind. And when it comes to medicine, I got to read this because I'm teaching pharmacology again, and I'm teaching this to the naturopathic students. And this is one of the first things that I talk about anymore. Because when you have 7 minutes with a medical doctor who's going to prescribe a procedure or a drug, you need informed consent. Hold on, because the passion's coming. Informed consent. This is a process by means of which a research participant agrees to be the subject of research, a principle in medical ethics, medical law, media studies, and other fields that a person must have sufficient information and understanding before making decisions about accepting risk, such as their medical care. Isn't it fascinating that Wikipedia would pick up on medicine first? Probably because it's potentially the most deadly. So let me give you the medical definition. The process in which a healthcare provider educates a patient about the risks, benefits, and alternatives of a given procedure or intervention. The patient must be competent to make a voluntary decision about whether to undergo the procedure or intervention. An ethical and legal obligation. So, when was the last time you had informed consent at the hands of a medical doctor, Eli?
Well, yeah, what amazing topic and very good question, because as you know, I'm on a little bit of my own health journey right now, and I have been interacting with mainstream doctors, which that part of my journey is almost over. And let me tell you, The informed consent does not exist. Does not exist. And she knows I'm a doctor. So I get a little more leeway in what she's willing to let me do and try on my own,
Right.
which whatever I do what I want to do. But,
Right.
but she didn't tell me about any of the stuff that I know are alternatives. And I called her out on it.
Mhm.
I called her out on this whole informed consent thing, and she looked right at me and she said, "You think I have time to research all that and then turn around and communicate things I know nothing about to the patient?" And I said to her, informed consent says nothing about you knowing how to do that stuff. Informed consent says that you need to tell the patient that those are options and then help them find a referral.
Right.
That's a good doctor. Help them find someone who can guide them through that, should that be what they decide. But it doesn't happen.
No, it doesn't. And so I'm teaching third-year medical students, naturopathic medical students, and one helped me after class to say, I just need to run this by you, Dr. Fleetwood, because we have a patient coming into the clinic who she's got urgent hypertension. It's like 160, 180 over 100 every time she comes in, but she refuses to get a prescription filled. I was like, all right, you're a naturopathic student. The patient gets 3 options. The patient can choose medical management. She's already said no. The patient can choose to do nothing, which is what she's been doing, but she keeps coming in. Why don't you give her informed consent? Because she could choose disease reversal. It's an option, naturopathic student. And he said, well, here's what happened. The attending doctor, the clinician, said, write her the prescription for lisinopril, but don't tell her about the 20% chance that she's going to get a cough.
Oh.
And I said, and he goes, I just want to know what your thoughts are about that. And I just smiled and I said, you already know my thoughts about that. The bigger question is, why is your clinician, who is presumably a naturopathic physician, not offering disease reversal? What the what? You're in a naturopathic teaching clinic. So he just smiled and he said, so it's unethical what he did, is what you're saying. That's exactly what I'm saying. It's unethical that he's not providing informed consent, and he's not providing the option that should be the first thing that gets offered through a naturopathic setting.
Right.
I had another student contact me because one of her projects at the end of a quarter was to determine through a literature search if type 2 diabetes could actually be reversed. So you have to do a literature research on that? Of course it can be reversed. It's a lifestyle-driven disease. If you look at any of the medications that people are prescribed to lower their numbers, every drug manufacturer says this should be used in conjunction with diet and exercise. That's lifestyle stuff. In conjunction with or after that's been tried and failed.
Right.
And the student said, wait, say that again? Because it sounds like they should come to us before they go to medical doctors. Like, bingo, girlfriend. Because conventional medicine shines in trauma care. Whether it's scheduled trauma, like surgery, or it's unscheduled trauma, like a biking accident. Just saying, that's a possibility. So that's when you want trauma care.
Right.
But this chronic disease stuff that we're dealing with, these are lifestyle choices, and my people perish for lack of knowledge. So getting a message out there to folks that you have the potential to reverse this chronic disease. And I don't care what the disease is. Maybe it's cancer. You can reverse a lot of that. I haven't worked with all the different kinds of cancers, and I wouldn't work with cancer for about 15 years. But people come to me now and they're like, I'm not going to any other medical doctors. I like how you do things. So, and I got cancer. So just take care of me like you take care of people. And lo and behold, their cancer goes away. Oh, so now I'm not afraid of cancer. But autoimmune conditions, those can be reversed. I've seen so many of them. And then I get in trouble with our profession. I don't understand this, saying that you and I are talking smack and we can't actually reverse things. And we're like, well, quit talking to me. Go talk to my satisfied clients.
Right.
We aren't limited, we vitalists, because we're banking on natural laws. And I'm pointing out there because that's where my nature is. It's right outside those windows. As long as we have gravity, we have natural laws. And as long as we have natural laws, we have a job. Because as long as we have natural laws, we're going to have natural people violating natural laws and trying to see how long they can get away with it. Or they don't know that the choices that they are making are taking them further and further and further away from their desired health goals. Because
Right.
our culture is just riddled with junky information and junky food. So,
Well, and I think it's more than that. So, one of our founders, our main founder who started this whole naturopathic medicine institute movement, along with his colleagues,
mhm,
his and their big concern was that students in naturopathic clinical training settings
mhm,
cannot learn if they're not taught
correct,
the potential the body has to heal.
right,
And if you don't know how to restore health within the human body, you can't teach someone else how to do that.
right,
If you don't see it happening, it's very hard to believe that it can
right.
happen, right? Like I don't know if you've ever heard this story, but in my early years, I had a patient with gangrene and I was treating. Have you heard this story?
I don't think so.
So this was one of my first run-ins with doctors in a hospital setting. And I don't think they were prepared for the little package of dynamite that I am. So I was treating a different family member when I got a call the Friday. It was a Friday. And I got a call that the one of the sons had been in a motorcycle accident and hadn't been wearing any protective gear, had been drunk along the highway, the asphalt, was in the hospital, had been there for a couple of days, and they were going to cut his leg off at the hip because he had developed gangrene in his leg. And they wanted to know if there was anything that I could do. Was there anything I could do? And I said, the question is there anything I know that could assist his body in healing enough that we get him out of the woods and postpone that surgery? That's the question. Is his body able to heal from that? And I said, I don't know, but I'll sure give it a try. And so I showed up at the hospital with my little box of homeopathy and with some herbs and it was just a little kit, right? An emergency kit. I show up and it's all bandaged up. And, first I'm not on staff at the hospital. And so they're very particular about who's allowed to do anything. But thankfully, the mother was also a package of dynamite. And between the two of us, we really bullied enough people that they let me unwrap the leg, see what it looked like. And this guy was chatty. He should have been like comatose. He had to be in so much pain, but he couldn't stop talking. He was chatty, 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 which ultimately led me to choose a particular homeopathic remedy for him.
Uh-huh.
That, along with some hydro and some other stuff, I got the doctor, the attending, to agree to wait 12 hours and reevaluate the condition of the tissue. And it was definitely gangrenous.
Yes.
And we did this over the next 3 or 4 days, 12 hours at a time. I fought for 12 hours at a time. And they kept, so after the first 12 hours between the homeopathy and some other stuff that we did, it started to improve, and it started to improve significantly. And as long as it did that, he continued to postpone the surgery. And that man walked out of the hospital intact, both legs intact, about 10 days later. And you want to know what they ascribed to that reversal to was the new type of bandaging that they put on, and the drain that they put on. And you know what? That was fine with me. I was like, doesn't matter to me. It doesn't matter to me what helped that young man keep both of his legs. And good job all around, people. But you've never seen that. Now, the reason I tell this story is because that same doctor over the years, this is almost 20 years ago, has reached out to me to ask me questions for other patients periodically. Because he saw something he'd never seen before, something he didn't even know was possible. So I bring this up because as much as it hurts my heart, and as much as I think Dr. Sensenig was right, that it was a crisis at the time we started NMI, this lack of passing on knowledge about how the body can heal itself and what you need to do to get that to happen. It's still happening. Maybe not as much, maybe more, I don't know. But don't you think that plays a role in informed consent? I'm playing a little bit of devil's advocate, even though I'm on your side of the fence, because I agree with this too, but how can a physician do adequate informed consent if they're not required to learn all that could be offered to a patient?
Right. So part of it is just open your eyes.
Okay. Yes.
If your eyes as the conventional medical profession, if your eyes are open enough to come attack us, then quit attacking. It's rule one, I think.
Yes.
Be open-minded, scientists.
Right.
They're so blinded by their own dogma that they can't, and part of it is a belief system. I'm completely convinced that belief drives behavior, which is the two slides from what I just read. And this is what I'm teaching third-year naturopathic students, and encouraging them to line up their beliefs with how they will practice medicine, because they're going to practice it that way. But I want them to be aware that this is their choice. You can choose medical management. I don't care. There are plenty of people that want to be medically managed. They don't want the responsibility of changing their lives to be healthy. Some people are so caught up in the diagnosis, it becomes their identity. If you take that away, what would happen?
Right.
So plenty of medical management. Go do that and do it joyfully, but you know that there are people who are reversing disease. So even if you choose to not do that because you don't believe that you could, that's fine. I'm doing it all day long. Send them to people like me. And so these students, I have this luxury. Shh, maybe I shouldn't say that, because for the first time in all these years that I have taught pharmacology, I've got twice as much time. So I'm teaching half the material this quarter only through week 6. Got to learn all the stuff in 6 weeks, because then we're going to pivot. And they got to write prescriptions. They got to write it. They got to look it up. They got to get information. I've given them cases. They got to figure out what to do next. And this past week, we pivoted, we transitioned, because now they're bringing me their cases and we're going to deprescribe. We're going to reverse the disease. So I get to teach students, not being in the clinic, how to language how to speak to their supervisors to say, have we considered this as an option? Have we given informed consent? Could we maybe do some disease reversal and some deprescribing simultaneously?
Right.
Hopefully, I am equipping, empowering, educating, and emboldening them to be naturopaths, for crying out loud, instead of functional doctors.
Mm-hmm. Mm-hmm.
Because disease reversal is so flippin' rewarding. When you work with somebody who has gangrene and is going to lose a leg, or diagnosed with multiple sclerosis and can't walk straight, and they start living differently. Now, the gangrene guy, that was an accident, but I don't think, my belief is that accidents aren't really accidents. There's something going on in your psyche that kind of calls for a particular manifestation. Like the time I was painting and walked slam into a window box that I was painting inside of, and I end up on the floor going, really? You got to knock me down to get my attention?
Sometimes,
Oh,
sometimes that has to happen for sure.
yeah. So, but to watch multiple sclerosis reverse, yes, I have multiple times. So I say this with confidence. Type 2 diabetes and high blood pressure and cholesterol issues, easy peasy, no big deal. So that's what the students are working on this week, is
That's exciting.
cardiovascular things and gastric things. I'm saving the tricksy stuff, the autoimmunity and the mental health, that goes next time.
Right. Well, it's more involved.
Yes, it is. So
yeah,
gotta whet their appetite and hone their skills a little bit at a time. We're starting with high blood pressure.
Now, part of my audience is made up of physicians, MDs, DOs. Part of my audience is made up of physicians who have realized there's another paradigm to health, and they've stepped over and they've started their journey learning about this. Most of my audience are people who have been failed by mainstream medicine, and they're really trying to understand. And it's not just me, right? They listen to a lot of podcasts, they follow a lot of people, learning how do I create health? What is healthy, right?
Yeah.
So I know that when you say deprescribe, all kinds of ears just perked up and went,
right.
Oh man, you mean getting off of medications? You mean I don't have to be on these medications my whole life?
Correct.
And the thoughts running through their head right now.
Yeah, okay, so thank you for that, because let me get up close to the camera so that you can see my stern look. Do not take yourself off your medications. Do not do that. Too many people that I take care of come to me after they've come off of their own medication and they're in bad places, and it becomes a rescue mission. Do not take yourself off your medication. Disease reversal has to start first before deprescribing. But the two run simultaneously, sort of. So you have to make your changes. You have to change your lifestyle. You've got to remove the obstacles to cure and establish for the first time or restore the determinants of health, which means tricksy stuff like eat real food, drink clean water, move your body in fun ways so that you do it every day, get restorative sleep, and live your life on purpose. Healthy relationships, purposeful work, stuff that lights you up and gets you out of bed in the morning, because you get to do it all over again. I get to go to work. I get to take care of people. When work becomes a 4-letter word, you are not living on purpose. So these are the determinants of health. Who is talking about this?
Other than naturopathic doctors, some
more people are.
Some naturopathic doctors. More people are.
Yeah. Casey Means is one of those medical doctors who's figured out that there's something else going afoot. There's something else out there.
Like another dimension.
Right. And it's so fun to find folks in the conventional medical world, medical doctors, pharmacists, nurses. Oh, the
Yeah.
nurses are so fun. They're like, oh
Well,
my
the nurse,
gosh, I
I think a
figured this
lot of,
out.
well, I think a lot of nurses have that built into their DNA. They know, like Florence Nightingale passed
Uh-huh.
something out through the ethos, right? She she got it.
Yeah.
She understood.
Yeah, I've taken care of a couple of critical care nurses, and I can't go back.
They're
I can't go back.
traumatized.
Well, it's like I didn't know that this sort of thing could happen. But now that I know, I don't know that I can go back into a hospital setting. And so and two of these gals have become best friends of mine. One is in education, and the way that she has changed nursing education in her little part of the world is so fun because it's so much more patient oriented than it had been. And
Right.
she's totally open. She's like, I'm thinking a little bit of arnica would go far for this particular. Can we
That would be homeopathic arnica, folks.
homeopathic arnica?
Yes.
Correct. Thank you. Um, and the other one is the more recent one. She's like, Dr. Fleetwood, I'd been seeing a whole group of naturopathic doctors for an entire year before I sought your care, and I was not getting any better. And she sent me a list of all the supplements.
Oh man, I know.
And I was like, honey, you got to quit taking this stuff. I don't know how much of this is helping and how much of this is poisoning you. But we almost immediately got started with constitutional hydrotherapy, craniosacral therapy, and holistic counseling because
Oh
I
yeah.
could see her homeopathic remedy in all the things. She told me later that she could feel her organs shutting down. And sure enough, she came in with labs that I was looking at going, oh,
Your organs are shutting down.
well, I've never
Oh,
seen liver enzymes this high. That's fascinating. Um, she's like, I think I have autoimmune hepatitis going on. I think I've got pericarditis going on. I've got something going on with a kidney. I just got out of the hospital. They put a stent in. They want to do surgery for some congenital malformation that's only started to affect me in my 30s. So, and prayer. We had quite a bit of prayer here in the office. And within weeks, because that was her silent prayer, God, if I'm on the right path, then I'm going to start seeing those liver enzymes come down dramatically. And she was checking every 2 weeks or so. They were coming down dramatically.
oh wow.
It
That's
was
cool.
lovely to watch. But now, now she is very invested in our medicine and is looking for places to speak and who we can team up with. She's got her eyes peeled for all kinds of bridge building.
That's very cool.
Fantastic. But
That's very cool.
It's hard for the medical folks because it kind of is 180-degree shift. And there are, for all of the folks listening, there are times where the two can go parallel. You can have conventional medical care for something scary and have naturopathic care walking right along with it. And it works until it doesn't, because you will come to
A
a hard
T.
part.
Yes.
And
You
that's
have
where
to
your
make a
belief
choice.
system, yeah, your
Yeah.
belief system has to kick in. And I prepare my people, you're going to come to this decision point. It's going to look like, and I tell them what it will look like because it's going to be different depending on what the disease state is, right? You're going to come to this point and you have to make a decision whether you go naturopathic route or you go conventional medical route. There is the philosophical divide happens at that point because the body's wisdom either gets expressed and you have the potential for fabulousness after that, or you shut it up one more time.
And go right back to what you were doing, which drove you to seek something different to begin with.
Or that's the last time.
Or
Because you
that's
shut
the
that
last
body's
time.
with after you've been letting it come up and letting it do its thing and letting it tell you which way you need to go. And then as it's building momentum, you go, okay, I'm scared now. So let me turn the volume way down. And the
Right.
body's like,
That's it. I'm done.
done. Yeah.
Yeah, done. I don't have it. I don't have enough left in me.
Right.
Yeah. So, okay. Well, I want to bring us back to informed consent for a minute.
Yes.
So I know we were talking about deprescribing. Thank you for that very wise message of, and I agree. And I tell people this too when they come in: do not take yourself off your meds, please. We'll get there. It's systematic and there's a process to it so that you're safe. But so I was talking with another colleague not very long ago about this whole informed consent thing because I don't feel they did a good job during COVID. I don't feel like they do a good job during flu season, and I don't feel like they do a good job most of the time with informed consent, like you've said. What? So we were brainstorming what could possibly be done to make sure that informed consent actually happens at all, but happens thoroughly and completely. And I think some education, whether they want to be open to it or not, there have to be people within the mainstream medical system and within the naturopathic system who are open enough to learn how to do informed consent. Like, is there a class in mainstream medicine, or I don't even think they have this class in the naturopathic schools called informed consent? How do you provide informed consent for the whole breadth of the not the zebras? Zebras, right? We can't address zebras. They're rare and they don't happen often. But for the bulk of things, how does a naturopathic doctor do informed consent for cardiovascular stuff? And how does it like MDDO, like mainstream, right, philosophically driven medicine? There has to be a way to fix this, whether they want to open their eyes or not.
Right.
Should we write a book?
We could. I've got a couple. I've got at least one that needs to get out before we start that one, and then
Okay.
there are like 7 or 8 others that I need to write. But
no.
If the first one goes as well as I think it will, then I may just need to divide my time between authoring books and taking care of folks, because I love taking care of folks. I love it.
I know you do.
But it seems pretty straightforward to me. And maybe that's because people have already done everything in conventional medicine that they were told to do and still aren't getting anywhere. And so they come to me and I show them the therapeutic order and go, this is where you've been living. These top 3 steps. Out of 7 steps, you're doing steps 5, 6, and 7. What if we look at steps 1, 2, 3, and 4? And they go, oh, that looks like a lot of stuff under those steps. There aren't that many things listed under steps 5, 6, and 7, because that's nutraceuticals, pharmaceuticals, and surgery. Okay.
Right.
But there's stuff like restoring health and removing obstacles and stimulating your own healing potential and taking out the trash and strengthening up your systems. Wow. I didn't know that was a thing, but
They don't.
And the light bulbs seem to be going off over their heads. It's sort of like a display of fireflies, right? They get lit up.
Yeah.
There are so many other things that we could be doing. Yeah. Well, that therapeutic order is ours, but it's published in lots of places. It doesn't seem, it's not rocket science. Anybody could look at that and go, well, this makes sense.
It's the laws of nature.
Why aren't we doing this? Well, we need to teach the laws of nature, right?
We
They're
do.
not taught in conventional medicine.
Well, they're not taught anywhere.
I'm teaching them in
Well, I mean,
pharmacology class.
NMI is teaching
And
them.
I'm teaching them.
We
Yeah,
individually are teaching them to people. But
right.
all, don't you think all healthcare providers should have to learn the laws of nature?
They should. They should. And it's built into basic sciences, but again, it depends on what you believe.
Right.
Because the instructor of physiology is going to teach physiology according to what they believe. So they'll teach physiology and biochemistry according to, look at all these SNPs, look at all these places where biochemistry gets wrecked. We got to fix all of the SNPs. So then that goes to physiology, and your physiology won't work because of this problem and that blockage and this genetic whatever, blah, 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 blah. But if you're viewing that from the belief of, no, man, we got all kinds of wisdom built into us. I would say we're made in God's very image. We've got his thumbprints, his fingerprints are all over us. If we'd listen to your longest time closest friend who speaks to you in the kindest way that will still get your attention,
Right.
which
Right.
means sometimes things break because you are not listening. As your
Right.
spirit soul is saying, hey, come on, let's live congruently here. She's not doing it. I know. Now what? What do we do? Well, we knocked her on the head and dropped her to the floor last time. We're just going to break her ankle now. She'll have to sit. She's going to have to listen.
Right. Yeah.
Personal story. So when we see the body as wise, then when we're teaching biochemistry and physiology, we teach it from that wisdom standpoint. This is what we think we know, and that needs to be pointed out. So medical doctors listening, were you not taught in your very first year that by the time you graduated, most of that information would be considered irrelevant? Were you not taught that the heart is the pump, but at the same time, if it's really the pump for everything, it would be blowing out the retina and the kidneys and the toes? So why do we continue misinformation? That's a big question in medicine. Why do we continue to teach when we know the model is not correct?
Well, because my daddy did it that way, and his daddy did it that way, and his daddy did it that way.
But now we have research, we have laboratories that can say, you know what? That's not how the heart could work. It would not sustain life. It would end life.
Exactly.
When we have folks coming to our vital gatherings and teaching us that I tried to prove conventional medicine correct and I couldn't. The model is wrong. I tried it with the heart. Their model is wrong. I tried it with the muscle. Turns out their model's wrong with the muscle too.
Yeah.
But this hypothesis seems to be working very well. I keep trying to prove it wrong and it keeps coming back up.
It's like herring.
When you've got a scientist with that kind of mindset,
yeah,
then you can learn new things.
Yeah. You know, that's what happened with Herring, Constantine Herring.
Yeah.
The amazingly great homeopath.
Mm-hmm.
His job was to prove that homeopathy was false and homeopathy didn't work. That was his job. That's how he started. And not very long into it, not only did he realize he couldn't prove it wrong, but that the principles embraced and used by the homeopaths, by that thinking,
yep,
were actually going a greater distance to prove how conventional medicine at that time had it wrong.
Right. And his laws for healing from the top down, from the most internal to the most external, and in reverse order of occurrence, that's how we're formed. That's how we're formed.
It's how we heal. It's how we're formed. Yeah. It's how the laws of nature work.
Natural law. Yeah.
Yes. Yes.
So back to informed consent.
Yes.
When people come to me, they're already frustrated. They're already ready for the alternatives. And I used to really get annoyed that we were called alternative, because we've been around longer. Our medicine's been around a
Yes.
lot longer than conventional medicine. So
Yes.
they're the alternatives
Yes.
in that pejorative sense.
Yes.
I don't mind being called alternative to conventional medicine.
Right.
Absolutely, I'm alternative. I am not them. I am
Yes.
not them.
Don't
I
want to be
didn't do
them.
what they do. Don't want to be them.
Right.
Please don't ever get my initials mistaken. Do not
Right.
put me in the phone book as an MD.
Right.
Loss of business right there.
Yeah.
I should sue you. But because it happened, I'm like,
Yeah.
please change this. This is not good. And I'm not the least bit concerned about the medical society. I don't want it because of business reasons. I don't want to be a medical doctor. No, no, no,
Right.
no.
Right.
So when it just seems like any doctor would be able to say, well, from a medical standpoint, as a medical doctor, you have this diagnosis. So here are your options. We got protocol A, B, or C that they involve one procedure and two different categories of drugs. Within those categories of drugs, we have this group or that group, and we could narrow it down from there. So that's the conventional informed consent. But conventional doctors know that naturopathic doctors exist, chiropractic doctors exist, Ayurvedic practitioners exist. There are lots of body workers, but their blinders are on, and in their belief system, all of these others are just that. They're others and they're outside, and they must not be worth anything because they're not in the conventional medical paradigm.
Yeah.
They could still at least mention that these alternatives exist because that is part of informed consent.
Yep. Yep. I've often thought there should be a place that any doctor with any credential could call and basically say, I've got this patient and I need to generate an informed consent for a patient, regardless of their diagnosis. In my mind, that would be a fabulous way to use AI.
Well, I was just thinking that. I'm on the same,
right?
Yeah.
That would be a use of AI, and not just where you tell someone go to Google and look at AI, but where you have a tool that any physician not only can use, but has to establish in the chart that they used. It becomes part of the chart note, and that this is reviewed. This was reviewed with the patient. And it not only includes what they typically do, but the other options that are available. And if the patient chooses those other options, well, maybe these guys need to have an other referral network. Or, the patients have to put that's on them now to go find their other things, their opinions. But how do you know to go look for it if you don't even know what to go look for?
Correct.
Yes. I wish there was a body that was over all practitioners of all different types of healthcare, unbiased, like there. And they made rules like this. And they said, you have to do this, whether you want to or not, that are not controlled by pharmacy, not controlled by any controlling them, right? Who's there for the benefit of the patients. In my mind, that's what my magic wand would create. A regulatory body that makes sure informed consent is actually being done thoroughly and completely, a tool to make sure that happens that is inclusive and not exclusive of what is available, and that it becomes documented part of a patient's, chart history.
I love that idea. Okay, so that needs to be part of our book.
Yeah.
Yeah, and
how do you fix the problem? You know me, when I write a book.
Yeah.
Here's the problem.
Here's some
here's how we
solutions.
fix it. I even do that on the boards that I sit on. I am famous for pointing out problems. In fact, I think sometimes that when I show up to a board meeting, when I'm like new to a board or something, the people
Right.
know me and I can hear them groaning in their mind because the status quo is about to be seriously disrupted. I also think Dr. Christie Fleetwood has a little bit of this reputation as well. So, but I don't
But we
like
bring
to
solutions.
come.
We bring solutions after we
That's the point.
spotlight the problem.
Exactly. It's good to point out when things could work better.
Right.
And it's really helpful when not necessarily that your idea to make it better is adopted, but that you at least offer these springboards that
Right.
you could say, well, that's a good idea, but here's how we can make it even better. And you get people's juices flowing with solutions. And
Right.
this is a problem. I'm very glad we talked about it today.
Mhm.
And that's my dog joining us in the background. He's playing harmony there. There is a solution to this,
Yeah.
and somebody somewhere can solve this. And it just takes someone with the authority to make it happen. And too bad, so sad, you people out there. Cat's out of the bag. Cat's out of the bag, man. You don't have the only solutions. There's lots of them out there. So we're a little bit over. Sorry about that, folks. I'm going to ask you to leave our listeners with a final message.
Oh, a final message. Your health is in your hands. You are the only person responsible for you. No one else can make your choices for you, and you wouldn't have it that way. So don't let it be that way with your health. Don't let the doctor make your decisions. You make your decisions. And if you want more information, ask for more information. If that doctor doesn't have enough time for you, fire that professional and choose a different one that matches your belief system.
Oh, I love that. I'm so glad you said that. Folks, thanks for being here. Dr. Fleetwood, thank you for joining me on Vital Wisdom today. As always, I could talk to you for hours. It's a hoot. I love interacting with you. Y'all stay tuned. I don't know what we're talking about next week, but I'm sure it's going to be fun and informative and enlightening. And I hope y'all have a wonderful day. Thanks for joining me today. For those of you who have written in, emailed, and are interested in my books and other offerings, I wrote The Unvaccinated Child as a resource guide for parents and caregivers to navigate childhood illnesses in a natural and healthy way. And while the intended group was the unvaccinated, it turns out it's an important resource for the vaccinated kids as well, since vaccines do not necessarily prevent illness. Smoke Rings is another book I wrote, and that's to help smokers support their health, regardless if they plan to quit or not. So for people who smoke, love a smoker, used to smoke, continue to smoke, this book helps you be your healthiest version. And when I say it is judgment-free, it is absolutely judgment-free. You're free to make the choices you make. I'd just like you to find better health while you make those choices. My most recent book, Homeopathy, A Foundational Approach, is really great for someone, whether they're a complete beginner or they've already been practicing homeopathy. It starts at the beginning and it guides the readers through the basics and on into first aid and acute practice, so you can start using homeopathy right away. That's the most important thing to me, is to get folks using homeopathy in their everyday life. My workshops and courses can be found at either ecampnd.com or longshadowsranch.net. Have a great week. Again, thanks for joining me and thanks for your support.